Dr. Guleria, let me bring you in on this conversation because there's two parts or two verticals that seem most critical at this point. One, what is the safety and efficacy of the vaccines being considered? And two, what kind of estimated cost are we looking at in terms of rolling these vaccines out? Is there a clear sense on both, sir, or are they both still a bit ambiguous?
No, I don't think they're ambiguous. I think we have had a lot of data in, and regulators are not going to allow any vaccine to come into the market unless we know that it's safe and it's efficacious. I think safety is paramount. So the data has to be looked at for all the vaccines, whether it be from coming from outside or the ones that are undergoing phase 3 trials in India. Unless the data is robust enough to show that they are safe, I don't think they will get rolled out or be given regulatory approvals. So I think it's very important for citizens in our country to understand that vaccines are going to be safe, they will be efficacious, and only then would they be rolled out as far as the vaccine program is concerned. Regarding the whole cost of the program, it's a huge task that the government has undertaken, but it's going to be done at the government's expense, and they are already prepared for it. The cold chain that has to be in place, the storage sites of keeping the vaccine at -20, training the vaccinators, getting sites ready, and also the ancillary stuff that is required, like syringes, needles, swabs, and then working on a strategy of looking at the biomedical waste which has to be taken care of. And remember, this is a task which needs 2 doses of the vaccine. So this whole exercise has to be repeated again in a sort of seamless manner after 28 days. So it's a huge challenge, but there is a lot of work which has been going on for the last few months in preparing the list of individuals who need to be vaccinated, getting the cold chain ready, ordering the needed equipment for storage, and working on how to transport the vaccine across the country using various vehicles so that it can be done in a seamless manner.
Let me draw on you a little bit more, Dr. Guleria, on the cost part of this, because that will be important from the budget point of view and what the finance minister sets aside. I mean, early estimates point to between $1.4 to $1.8 billion just for the first phase of a coronavirus vaccination. As you pointed out, there are ancillary support and storage required, another $30 to $50 million for that. From what we've seen in the last couple of budgets, the allocation to health has remained quite low. For FY21, we were looking at 69,000 crores. What kind of figures, sir, do you think would allay any doubts that people might have in terms of the fact that there is enough and adequate financial support for what is clearly a big health challenge?
So I'm not an economist to be able to give you exact numbers, but I'm pretty sure that we will have health has actually come onto the center stage. So I'm pretty sure that for the coming year, health will be a priority as far as the government is concerned, and I'm sure it will really figure in a big way as far as the budget is concerned. When we're looking at health, we're looking at not only COVID, we need to look at the health infrastructure, as far as what COVID has taught us in terms of preventive health, in terms of looking at promotive health, and how we can really build a resilient India so that it's healthy for the future. And I think that is the message that the pandemic has taught us, and we need to really work on that. We've been able to do a lot during the pandemic in terms of improving the health infrastructure, but there's still a lot that needs to be done.